Good morning, everyone. I'm Leody Maimi Monteveros, and to continue with the other types of hypertension, we have here the neurogenic hypertension. Neurogenic hypertension could be of two types. It can be an acute hypertension or chronic hypertension. And here are the causes of the acute neurogenic hypertension. First off, we have strong stimulation of the sympathetic nervous system. So this happens, for example, when a person becomes so excited or anxious, the sympathetic system becomes excessively stimulated. And because of that, the peripheral vasoconstriction would occur everywhere in the body, and that causes acute hypertension. The second and third causes would be when the nerves leading from the baroreceptors are cut and or the tractus solitarius is destroyed in each side of the medulla oblongata. So note that these are areas where the nerves from the carotid and aortic baroreceptors connect in the brainstem. So if there is sudden cessation of normal nerve signals from the baroreceptors, this would lead to the loss also of the normal inhibitory effect on the vasomotor center. So without the inhibitory effect, your vasomotor center would become extremely active. So that will result to an increase in the mean arterial pressure. However, there's also this central resetting of the baroreceptor pressure control. So within 2 days, normally, since there is absence of the baroreceptor signal, the response of the vasomotor center would also fade away, and that will lead to the pressure returning to the normal levels. And for the chronic hypertension, it is caused by the activation of the sympathetic nervous system during weight gain and obesity. So activation of the sympathetic nervous system will stimulate the renal sympathetic nerves, and that would cause the impairment of the renal pressure natriuresis and causes chronic hypertension. And for the genetic causes of hypertension in several strains of animals like rats, rabbits, and dogs, there is spontaneous hereditary hypertension. And based on studies of hypertensive rats compared to the normal rats, they found out that the sympathetic nervous system is considerably more active in hypertensive rats. And also, they have observed that there are structural changes in the nephrons of the kidneys of the hypertensive rats, which causes increased preglomerular renal arterial resistance and decreased permeability of the glomerular membranes. And this actually causes the long-term continuance of the hypertension. As for humans, several mutations in the genes also cause um, hypertension. However, this is a rare condition. We call it the monogenic hypertension, and it accounts for less than 1% of cases of the human hypertension. And their common ground for these mutations causing hypertension is that they all cause impaired kidney function, either by increasing resistance of the renal arterioles or by excessive salt and water reabsorption by the renal tubules. And then we have the primary hypertension, also called the essential hypertension by the clinicians. It's called essential hypertension because of its unknown origin compared to the secondary hypertension. And excess weight gain and a sedentary lifestyle are the major contributing factors in the development of primary hypertension. Then we have the four characteristics of hypertension. Um, due to obesity and excess weight gain. First, we have the increased cardiac output. So additional blood flow is required for the extra adipose tissue and the vital organs like the heart, the kidneys, the skeletal muscle, and the GI tract to meet their increased metabolic demands. So as this happens over time and years, the total peripheral vascular resistance may also increase. And the second characteristic is the increase in sympathetic nerve activity, especially in the kidneys. Although this is not completely understood, but studies have suggested that hormones such as leptin that are released from fat cells may directly stimulate multiple regions of the hypothalamus, which in turn have an excitatory influence on the vasomotor centers of the brain medulla. And also there would be reduced sensitivity of arterial baroreceptors in buffering increases in arterial pressure as well as activation of chemoreceptors in obese person. And then we have the angiotensin 2 and aldosterone levels are increased. So increased sympathetic nerve stimulation would increase renin release by the kidneys and therefore formation of angiotensin 2, which in turn stimulates the adrenal gland to secrete aldosterone. And the last one, we have the renal pressure natriuresis mechanism is impaired and the kidneys will not excrete adequate amounts of salt and water unless the arterial pressure is high or kidney function is somehow improved. So it's not enough that there would be only a decrease in the arterial pressure. The kidney function must also be improved, else it would lead to anuria. So later on, there would still be retention of salt and water that would increase again the arterial pressure. Impaired renal pressure natriuresis in obesity hypertension is caused mainly by increased renal tubular reabsorption of salt and water due to increased sympathetic nerve activity and increased levels of angiotensin 2 and aldosterone. So if hypertension is not effectively treated, this will lead to severity of vascular injury and later on complete loss of kidney function. Now, as you can see here, this is the sodium loading renal function curve, and this is done for hypertensive patients to test out the normal functioning of their kidneys. So this is used to also distinguish those hypertension that is salt insensitive and salt sensitive na hypertension. So as you increase the level of salt intake, yung arterial pressure then would also increase. But the difference between salt insensitive and salt sensitive is that kapag salt insensitive yung essential hypertension, so that particular type of hypertension, hindi siya ganoon ka nag-i-increase or hindi ganoon ka nag-i-increase yung arterial pressure if there is an increase in salt intake compared to the salt sensitive na hypertension. As for the treatment of essential hypertension, nothing is more preventive than lifestyle modifications, which is aimed at increasing physical activity and weight loss in most patients. However, we have still general classes of drugs, two classes that are used to treat hypertension. These are the vasodilator drugs and the natriuretic or diuretic drugs. So for the vasodilator drugs, they increase the renal blood flow and glomerular filtration rate, specifically by inhibiting sympathetic nervous signals to the kidneys or by blocking the action of the sympathetic transmitter substance on the renal vasculature and renal tubules, or by directly relaxing the smooth muscle of the renal vasculature, or by blocking the action of the renin-angiotensin-aldosterone system on the renal vasculature or the renal tubule. So example of the drug, we have the hydralazine. And for the second one, the natriuretic or the diuretic drugs, they decrease tubular reabsorption of salt and water. So there would be blockage of active transport of sodium through the tubular wall, and this would in turn prevent the reabsorption of water. An example of the drug would be the hydrochlorothiazide, so thiazide drugs.